Do you have urinary incontinence and you don't want surgery? Have you considered a pessary? Maybe you've never heard of a pessary, or maybe you've tried one and you'd like to know how to make it work better for you. I'm the Kegel Queen. I'm a registered nurse and my name is Alice Adams. In this video, we'll talk about how a pessary can help you control your bladder. What is a pessary? A pessary is a thing that has a very, very, very long history. The word pessary comes from a Greek word meaning rock, because women back in the old days would try pretty much anything to solve their vagina problems, including sticking a rock up there to put things where they ought to be. These days we have something much more sophisticated than rocks, and this is just one example of a pessary. So a pessary is a thing made of silicone that come in lots and lots and lots of different shapes and sizes. And this particular one, I don't have a sample of one that's specifically for incontinence to show you, but it's a silicone thing that's flexible. It's kind of stiff but flexible, and you wear it up at the top of your vagina around near your cervix, the same place you would wear a contraceptive diaphragm. So for incontinence, you might wear a ring pessary. This is a ring with support, but if you can imagine this without this sort of trampoline part in the middle, just the ring. Sometimes pessaries for incontinence have prongs on them, little like nubs there that go on either side of the urethra, the tube that lets your urine out, to hold the urethra more where it belongs. There are all different shapes. This is just to give you an idea of what a pessary is. So how does a pessary help keep you from leaking? It's basically helping to they can work in a couple different ways, and it's working to either help hold your urethra closed, like by just pushing on it, or it's working to hold your urethra in a better position so that your body can do what it's meant to do as far as when to pee, when not to pee. The way that we're made is all so, what's the word I'm looking for? It's so specific. It's as if every detail is there for a reason, and when your urethra and bladder aren't in the right position, it can contribute to your leaking. So again, some pessaries work by just kind of helping shut off the flow by the pressure of the pessary itself, but some work by holding, especially the prong ones, work by holding the bladder and urethra more where they belong so that your body can do what it's meant to do in a more normal way. Let's talk about some of the advantages of a pessary. One big one, they're safe. A few things can happen with pessaries, but if you care for them properly and have a healthcare team working with you who is giving you good care, the safety issues should be no big deal. Probably the most common thing is to have some abrasion or erosion of the tissue, a little bleeding and irritation. Some of that's preventable, some may not be preventable, but even if you end up with that and you can't prevent it, a pessary is reversible. That's another tremendous advantage, especially compared with surgery, which is forever. A pessary is reversible. If something's going on with the pessary, it's not working out right for you, you just take it out. Easy. It's not like a lot of medical things where you make a decision and then you're stuck with it. The pessary just comes out. So those are some really, really significant advantages of a pessary. They're safe and they're reversible if you have a problem. For a pessary to work properly, you need a couple of things going on. Number one, the pessary needs to be fitted correctly. And for a good fit, you need two things. You need the right size and the right style of pessary. Pessaries come in lots and lots of different shapes and sizes, And lots of women need to try many different ones before they find one that really fits properly. It should be comfortable, it should stay in, and when it's fitted well, you shouldn't really know it's there. You can kind of tell it's there the same way as if you were wearing a tampon, but it shouldn't be like a strong sensation or something that you notice a whole lot. So one thing is a good fitting, and sometimes a good fitting is a bit of a challenge to get because a lot of healthcare providers don't put a lot of love and attention into giving really good pessary care. Some women need to go through many, many different pessaries to find a good one, and not every provider is willing to really commit to helping you get the right pessary. The other thing you need in order to have success with a pessary is that your pelvic floor is working well. So let's look at what the pelvic floor is and what that means. This is your pelvis, and this bowl of muscle here, this bowl of muscle is the pelvic floor. Now, when these muscles are a little bit slack, when they're maybe thin and don't have good tone, it can be hard for them to do their job in your body in the first place, but it can be hard for them to do the job of helping hold the pessary in place. So what you want is for the pelvic floor to have good mass, to be thick, and to have good tone, to be firm. And that's pretty easy to do by doing Kegel exercises correctly. Kegel exercises can absolutely help with a pessary by helping you build your pelvic floor mass and tone to the right level where they can really support a pessary. But the key is that you need to be doing Kegels correctly, because almost everyone is doing Kegels wrong, even if you learn from a physical therapist or a childbirth teacher or a doctor. Virtually nobody knows how to do Kegels correctly. Even if you think you do, you need to do them just right in order to get the therapeutic benefits. It's simple, it's not that complicated, but it does have to be correct. If you'd like to find out more about Kegels and pessaries and incontinence, please visit kegelqueen.com. I'm the Kegel Queen, and I'm here to help.